Royal College of Surgeons in Ireland spin-out company Pumpinheart. They have prototyped a trans-catheter implantable diastolic heart pump production. It treats advanced stage heart failure with preserved ejection fraction. The management team here is a mix of clinical engineering and startup expertise, and from that management team we are joined from Pumpinheart by Donald Hickey.
Thank you very much. It's great to have the opportunity to present here today. So advanced stage heart failure presents as breathlessness, even at rest, when the heart fails to pump blood effectively. Over 2 million people in the US and in Europe suffer from the dominant form of heart failure, diastolic heart failure, or HFpEF. These patients' heart walls are stiff due to age and chronic hypertension. They face a very grim and terminal prognosis. Many will spend the remainder of their lives frequently hospitalized for long periods, and many will die in hospital. There are no available effective treatments. Neither drugs nor devices reduce morbidity nor mortality. So Pumpinheart is developing a device that addresses the core problem of elevated cardiac pressures. It's a tiny device the size of a small crayon that's implanted in the left ventricle of the heart by an interventional cardiologist. The pump draws just enough blood during the resting phase of the cardiac cycle to relieve these elevated pressures and ease congestion. This pump would allow over 600,000 HFpEF patients survive this dreadful disease, breathe freely, and return home to lead active and fulfilling lives. The device has been bench tested very effectively, and the results are very encouraging. The patients, being elderly, are entitled to free medical care under national healthcare systems such as Medicare in the USA or the NHS in the UK. So if a device or a treatment is available, it will be prescribed. Furthermore, hospitals are facing a massive health burden of $100 billion as a result of the hospitalization of heart failure patients. At a price of $50,000, together with the widespread availability of cath labs, the short post-op recovery periods associated with cath lab implantation, we believe this device will be attractive to both healthcare systems and payers alike. This is a $32 billion total addressable market opportunity. Investors will be attracted by the fact that we're already working with Boston Scientific on the development of the transcatheter delivery system, and by the fact that Dr. Amr Hamid, who's here with me today, a cardiothoracic surgeon turned medical device researcher and the inventor of the device, has such great working relationships with key opinion leading HFpEF clinical researchers in the US and Europe, a network of first-in-human trial sites. To date, commercialization of this device, or the development of this device, has been funded under an EI commercialization fund grant of $500,000. And recently, we are delighted to have been awarded, at least Pumpinheart-led consortium are delighted to have been awarded a Disruptive Technologies Innovation Fund grant of $3.14 million to fund the preclinical phase.
Donald, I'll have to call time on you, I'm afraid. That is the time, so if you will come over, I'll ask you a few questions about it. The average lifespan of somebody with heart failure, so the number of years that you would improve quality of life, is roughly how long on average, do you think?
Well, existing pumps treating systolic heart failure appear to have, based on the literature, appear to have an average life of 5 years after the implantation of a pump. That's to treat systolic heart failure. We're talking about the other half of the heart failure patients, which is diastolic heart failure patients. But we would expect that this device would last them down till death.
And how does the pump cope with the fluctuations in heart rate and all the rest of it? And to what extent can it cope with them?
Well, this is one of the most interesting aspects of this pump, because what it achieves, it doesn't just add years to a patient's life, it adds life to their years. This unique aspect of this pump is that it is ECG gated, and that the mechanism of action of the pump is augmented with an atrial pressure sensor, meaning that patients, and atrial pressures increase when patients take exercise, or people take exercise. So this means that patients will be able to lead active and fulfilling lives with the pump.
Which is a radical shift for heart failure, because heart failure effectively means almost an incapacity to move, breathe, all of those things
Correct.
that go with living.
Advanced stage heart failure means you can't walk across a room without breathing.
Scale of market again?
The market scale is obviously massive. It's a $32 billion investment opportunity. It's a 600,000 advanced stage diastolic heart failure patients in the US and Europe in 2030.
Donald, thank you very much. Donald, stay where you are, Donald, just for a tick if you would.